So the thing about OCD is that there's a lot of common misconceptions. A lot of people think that it's just wanting everything neat and tidy, but there are all sorts of subtypes. Like there's scrupulosity, which is religious or moral OCD. There's OCD that makes you question your sexual orientation or gender. There's OCD that makes you worry about your effect on other people. There's just lots of different types.
So common misconceptions about OCD are that, for example, that it's just about keeping things in order, that everybody's just a little bit OCD, which they're not. The misconceptions are that it's something that you can control, and that it's a little bit quaint as well, and that it's something that is totally and utterly something that you have control over. It's not. The thoughts come into your head. You have thoughts at the expense of your moral compass. You don't want to be thinking those kind of things, but they keep popping into your head. And it's not a quaint thing, and it's not about lining up pencils in front of you. That's only a symptom or a facet of something far greater that's going on up here. There are a lot of misconceptions out there, and I hope we can dispel them.
So a common misconception about OCD is that it's just doing one specific action or like staying super organized. That's probably the biggest one is, when you're like really organized, you have to have your desk a certain way, that's OCD. That can be related, but there's a whole lot of different varieties, and I've heard it described as like flavors of OCD. It's hugely different for a lot of people. For me, it's rarely like the same thing. Like there are certain types of things that I feel more obsessive about, but it can be almost any decision. I all of a sudden just feel like it's hugely important that I make one decision. And a lot of the time it's not something that I originally wanted to do. So it's kind of against what I want to do. But I know it's different for everybody, but that's just how it affects me. And it's not so much like the being organized thing.
Common misconceptions of OCD. I think possibly people think that if you have OCD, that you're sick. I'm not sick. I'm actually very healthy. My mind is wired different. My brain is wired different. You can't see it, but OCD is there. Not always a bad thing until it controls you. But I think that people think they should be able to see it like cancer, but you can't.